On the Democratic side, there's still not an agreement on how best to reform the system. There is debate over what's called the single payer or expanding Medicare, basically calling it Medicare for all, another proposal out there. Democratic Senator Charles Schumer says that's just not feasible. New poll out this morning, take a look from Rasmussen Reports, shows that most Americans don't want a single payer system run by the government. Just 32% of those surveyed are in favor of it, while 57% are opposed. Congressman Anthony Weiner from New York supports the single-payer option. He's a Democrat, joins us now. Congressman, good to have you. We should point out, too, just to explain to our viewers, when we're talking about a single-payer, that's different than what is called the public option, which is out there. The public option is just that, an option that would be thrown into the mix. You could, theoretically anyway, make that your choice. What you're talking about is really a fully government-run system. Why do you keep pushing it when it looks so obviously in the polls like the American people are against it?
Well, actually, the American people like it a great deal. 40% of all bills paid in this country are paid by a single-payer system, Medicare, Medicaid, the VA, DOD. You know, frankly, the Republicans just put out a document saying we've got to protect and save and expand Medicare. Well, they're embracing a single-payer government-run plan. Let's call it what it is. All of us have a single-payer plan, but either we pay the insurance companies or we pay the doctor directly or we get paid for by Medicare and Medicaid. If you believe that the public option that your grandfather has or that your spouse has in Medicare is a pretty good plan, and maybe it should be for people 55 rather than 65, then you understand the wisdom here.
Congressman, Senator Schumer, as I mentioned, said basically this is never going to happen. Paraphrasing there, President Obama said it's just too big a shift for the American people, and he's not going to be the one that wants to stand up there and say, this is what you have to do. We're limiting your choices.
Yeah, it's not limiting anyone's choices. You'll still be able to go to your hospital. In fact, most Americans won't even notice. You know, right now their bill gets paid for by the insurance company to their doctor. Now it's going to get paid for by the Medicare system or whatever the single payer would be called. Most Americans wouldn't even notice it. I'll tell you one thing. It would be taking on the insurance industry. That takes about $250 billion each year in overhead and profits and puts it in their pockets. And the question is, what are we getting for that money? Are we getting better service? Are we not having 800 numbers? Are we not getting cut off for pre-existing conditions? If you think Medicare works, and frankly, for 40% of all Americans, it clearly does, then I'm saying this extend it to more Americans, and I think it's really not going to be that much of a shock to the system at all.
Let's just put up for some perspective. Fortune magazine, I should say, analyzed the profit margins by industry, and they put the healthcare industry at 35, the profit margin at just 2.2%. And just to compare that to what's number one on this list, communications equipment, networks, etc., they're at a 20.4% profit margin. Does that fly in the face of, you know, the argument out there that these insurance companies are just out there ripping everybody off?
Well, it's not ripping everyone off, but first of all, I said 30% in overhead and profits. The profit number goes up and down depending who you talk to. When we look at the top 7%, it's closer to 14, 15%. The question is, why should it be 1%? Why are we, the taxpayers, paying for their advertisements, paying for their bonuses, paying for their vacation jaunts? Why are we paying for that?
But they're businesses, and we live in the United States. Aren't they supposed to be making money?
No, but the question is, what are they giving back in return? Are they doing any checkups? Are they doing any operations? They're not. They're essentially passing through money that we give them to give back to us in smaller amounts. Their objective is to pay out as little as possible as they can. That's the profit motive, and I don't have a problem with that. The question is, why do we have it when we have the Medicare system, which has a 4% overhead, which has no profit motive, which frankly provides pretty good care? What are we getting in return for all that money?
Congressman Anthony Weiner, Democrat of New York, thanks for being here.
Thank you.